Well, no, he shouldn't be.
When they start talking, yeah, it'll show up.
Good evening. I'd like to call the meeting of the Equity Subcommittee to order. Madam Secretary, roll call, please.
Chairperson Thompson,
Here.
Ms. Doherty,
Here.
Ms. Delay. 2 present, 1 absent.
Thank you. Really excited about, we have a presentation today, and because there's a really lengthy presentation, I'm actually going to pivot immediately to Ms. Phillips so that she can introduce the consultants that we're here to hear from today. And then after that, I'm going to ask that we hold all of our questions because we might have several, and then we'll be able to interject those afterwards. Ms. Phillips.
Thank you, School Committee Member Thompson. And I'm also here joined by Dr. Rebecca Duda, who is the Family Resource Center Coordinator. And we'll begin with a presentation and a review of how the process was rolled out by our consultant, public consulting group. And I'll let them introduce themselves and take us through the methodology of the process and then their recommendations. And then I also will share which of the recommendations we're looking to put into place and on what timeline.
Excellent.
So if Jackie and Anna, if you're there.
Hi, how are you? Can everyone hear us okay?
We can hear you a lot louder than I think we want to. We're really excited to have you guys here. That's not your fault. I think that's a technical thing here. So excited to have you guys. Feel free to give your presentation.
Everyone, just checking to make sure you can also hear me okay.
Yes, we can hear you.
I do have a PowerPoint ready, but it's saying that I do not have host screen sharing capabilities. So if somebody could just pass along that, I'm happy to start sharing.
I believe they're working on that right as we speak.
No problem. Okay, looks like I can try now. Wonderful. Just give me 1 second.
Well, Jackie pulls that up. I just wanted to share thank you so much for taking the time to allow us to present on our findings today. And I know Jackie will go into detail on the process, but we were very lucky to spend the spring with Lowell Public Schools and get to know the enrollment process very well and, fairly intimately, and came out with a number of recommendations from the process. And it looks like Jackie pulled it up, so I will turn it over to her and she can talk about our work.
Sure. Hi, everyone. I just want to introduce myself. My name is Jackie Stokes, and I'm a senior consultant at Public Consulting Group. So as part of Anna's team, a group of us came to Lowell Public Schools. We've had the opportunity to interview many people. We've also had the opportunity to be on site at your district in order to conduct the enrollment process review. So I do have a fairly condensed version of the recommendations that we gave. So it's about 10 slides. I'm just going to give kind of a high-level overview of the recommendations. I know you all were given the lengthier document with more detailed recommendations. I'm happy to go into detail about any questions you have, but I thought it was a good place to start with this briefer overview for time's sake. So here's a little bit more about the background, why we did this project, what we did for it. So we wanted to identify opportunities for more efficiencies, and the goal was just really creating more equity and access at the district level for students to be enrolled. So here's an overview of the methodology that we used. As I mentioned, we did have an on-site, an in-person on-site where we were able to shadow the FRC clerks and the coordinator. We were able to do interviews with lots of different departments. And we also sent out a family survey, which we received 136 responses from. We have a lot of data from that as well that I won't go too deep into on this, but we do have a lot of robust information from families as well about their experience. So here are some primary findings, again, really general from the family survey. So families had a really positive experience with FRC overall and had a lot of positive things to say. They felt like they had access to the staff and the resources that they needed in order to get enrolled. Lots of families are using the walk-in option to be able to come in person to the district and get hands-on support. Families did mention there wasn't always a fast turnaround. So 68% of respondents said it took about a week or longer to enroll, mostly due to vaccination barriers and outdated documents. And the findings that we saw at PCG were very much aligned with the findings that we saw in the family survey. So I just want to make a note that lots of things, glow areas and grow areas that families commented on, we saw the same things and we had the same recommendations. So that was great for us to see that we were pretty aligned with your family and community. Okay, so some major kind of buckets of things we wanted to target for recommendations were manual and paper-based processes, so turning lots of things digital if possible and streamlining the process there. There was a lot of FRC staff touch points throughout. There's inconsistent practices and action steps, a lack of clarity in departmental roles, delays at many points in the process due to various things, and a lot of focus on newcomer and EL families needing additional support. So this included translation, language barriers, needing to pull in extra staff in order to support the large number of newcomer and English learner families that you have at your district. So here are 7 buckets of themes that we saw. So as you can see, and in the document that you have, we have a lot of recommendations around staffing, training, physical space and resources, family communication channels, cross-department coordination, Aspen system capabilities, and culture and communication. We have recommendations in all of these areas. For the sake of this presentation, I wanted to really zoom in and highlight staffing, cross-department coordination, and Aspen system capabilities, so buckets 1, 5, and 6. These are kind of the themes that are most prevalent and kind of thread everything else together. They come up a lot, they're really interwoven, so these are the areas that I'm going to speak to right now, but feel free to ask questions about any other area for recommendations. For staffing, we did recommend to hire additional staff to support the FRC and enrollment at the high school. Some examples of new hires are a front desk, what we called a triage staff person. So somebody that families can go to as the first person, and then they kind of organize which clerk that person needs to go to, or just gives them what information they're still missing or how to get that information in order to go to a different department. So really just kind of a coordinator or a triage staff person is how we've been referring to it. So somebody who can manage all the incoming families and requests. We also recommended an FRC associate coordinator, so somebody kind of below the coordinator who reports to them and supports with that work. Definitely more Spanish and Portuguese speaking FRC clerks. There's a very large need for Spanish and Portuguese speaking staff, and we know that the bilingual liaisons have been tapped to do a lot of this work, so we're hoping to hire more people in the FRC directly to be able to support that. And we also think a high school enrollment counselor, because there are a lot of students needing to be enrolled at the high school. Another role that we recommended was an FRC health liaison. We know that vaccines were a huge barrier in getting students enrolled at the district, and so we did suggest that another health liaison at the FRC would support families in knowing where to go to get vaccines, getting their documentation and their paperwork handy, and reaching out to them to remind them about this. The next bucket that I'll talk about is cross-department coordination. So you have a very large district. There are lots of departments, and they're all really important in getting students enrolled. The overall goal here is that each department is communicating with each other, and there's a streamlined, efficient way for not only the enrollment process to go, but for different departments to be able to understand where students are at in the process and to be able to communicate with each other what they need. And most importantly, that the FRC is able to effectively communicate with each department in two-way communication. So for the EL department, we'd like to strengthen the bond between the FRC and the EL department, increasing training, creating potentially an improved online scheduling system for the English learners screener, improving the practice as a whole in terms of getting students screened and identifying students as English learners, and then giving that information to schools. For the special education department, we have recommendations around more streamlined communication. In a little bit, I'll talk about the Aspen system and how we want to create alerts back and forth between special education and the FRC in order to understand where students are at with their IEPs and if they are identified as having a disability and needing support at school. For the health department, a lot of families weren't sure where and how to get vaccines. So family communication, Aspen, and vaccine information is all around helping families understand where they can go to get vaccines, where they can go to get a free one if they don't have health insurance, how long it's going to take, what kinds of vaccines they need, what kinds of paperwork they need, and being able to get that back to the FRC as soon as possible so they can start school. And then for the high school, the biggest one that I just mentioned, which relates to staffing, is hiring a dedicated high school enrollment counselor, and then mapping the workflow to determine clarity on registration, grade placement, enrollment, referrals, and family communication. Aspen is a huge bucket of work, of recommendations that we had. This you'll see threaded throughout every single other bucket that we have. So some general places where we think Aspen can really be, this was one of our biggest levers, let me just say, in terms of our recommendations as a whole, was really leveraging Aspen and trying to put as much of the process and communication into Aspen as possible, because every department has access to Aspen. And so if everyone is putting all of their information and talking to each other through Aspen, it's documented, it's visual, and it's all housed in the same place. So just in terms of efficiency and organization, we thought that this would be a really great place to have that, because you're already using Aspen in order to enroll students. So the first area was integration. We know that the phone system is heavily used at the FRC, so integrating the phone system into Aspen, which we have recommendations on, integrating the online scheduling platform for the English learner team, which I had just mentioned, alerts, so having an alert for users when, especially for the FRC staff, when new documents are added or missing, being able to alert the special education team if a student is triggered as a yes for special education or needs an IEP, so that the special education team can go track that down. We had recommendations around privacy. So when the FRC clerks are uploading documents and files, we want to be able to delete those off of their computers and have them only be living in the student file, digital file in Aspen. We do want to make sure that all departments have access to all of this so that they're part of this process and protocol in terms of getting students enrolled via Aspen. For data, we would like to set up advanced reporting in the Aspen system, so to be able to pull reports quickly and easily around demographics, around what students are in the process of being enrolled, why they haven't been enrolled yet, how long it's taking, what documents are missing. For system use, this relates to, transportation. We know that families often want busing for their students, and so they're not always clear exactly how to get busing. They're not, or which schools would be able to provide busing or what documents they need to provide. So cleaning that up to be able to make that more efficient for families in terms of transportation. The journal feature is so that staff can take notes about where they've left off with students. And if a family does want busing, for example, then somebody at the transportation department can add a note and say, please give families, a map of which schools they need to enroll in order to have that. Updating required fields. So knowing exactly so basically around rules of completion for knowing exactly which fields, staff do need to fill out versus which ones are optional. Making sure it's parent friendly so that parents can easily enroll students themselves using Aspen on computers at home or at the district. And then we also wanted to remove as many paper checklists and organizing tools as possible. So we do know there's a FRC paper checklist that staff have been using, but if everything is just integrated and digitized into Aspen, it would remove the need for any type of staff, extra paper that they need to put in students' paper files, and it gets clunky. So this would just streamline everything and make it completely digital. And lastly, these were just our own next steps for the district. So we wanted to probe more into EL services and programming, which I believe the district decided to do. We know there's like I said, a very large number of English learners and newcomers, and we wanted to make sure that those students were being supported in the enrollment process and beyond. That we do know there is a desegregation educational implementation plan. So we wanted to look at that a little bit further in terms of, updating policy procedures and guidance for school assignments. So basically just making sure that we're considering all aspects of a student profile when placing them into schools. So special education needs, English learner needs, location, transportation. And then our next steps were going to be meeting with Dr. Boyd and the school committee, which is you all as the subcommittee, figure out the priorities, which I believe Latifa will be going over, conduct action planning, which we're more than happy to support with, and then also just implementing these changes. Those are all of my slides, so I can stop sharing if anyone has any questions for me or for Anna about the recommendations in general, the review, any other buckets that I didn't talk about.
Thank you so much. That was a lot of really great information. I will actually pivot to my colleague, Ms. Doherty, who I saw writing voraciously and may have some questions for you.
Thank you. I'm okay right now. I guess I was going by the original document, so I was trying to keep track of what was being said and what was on the screen. In terms of the actual survey, I guess because there was a disconnect between what the survey showed and what I had been hearing from families. Granted, it wasn't as recent as the last couple of months, but in terms of people not getting emails returned or not getting the phone picked up, I'm just wondering how it was that you interviewed the families that you interviewed. How did those parents come to your attention?
Sure. We created a digital survey that we sent out to, I'm just pulling it up to see how many I do know that we had 136 families respond. We sent it out to any family that has a student enrolled within the district within the last 2 years, I believe, or at least a year and a half. So Anna, please jump in here if I misstated that, but it went to all of those families. Oh, Anna, you're muted.
Yeah, so we worked directly with the FRC, and I believe we ended up settling on just the past year because we wanted to make sure that we were using families that had had some level of interaction with the Aspen system as well. And, you know, and then particularly given COVID and closed offices, it made for a slightly different enrollment experience as well. So, and the FRC was then very helpful in following up as well to help us get that 136 response rate, which we're very excited to receive.
Yeah, the FRC made some calls as well, I believe, and we made sure that it was translated into Spanish and Portuguese so that we could capture as many voices as we could.
Excellent. Ms. Phillips, do you have anything that you would like to add?
Yes, so I believe that the list was created from September through the time the survey was implemented. So that might have been March, from September through March. So I do think that, and I can't recall how the parameters were set, but I do think that there's a rush at the very beginning, like a very heavy rush, and then there's just the regular cycle of placement. I do think that this group that responded are the regular cycle of placement, who felt that they were able to receive, you know, the attention that they got. I also saw that they were a large number of non-English speaking families. So I think that it demonstrates the job that we're doing with supporting our families that don't speak English as a home language. But there's the thing that we're still grappling with is that rush, you know, from like August to the first day of school, and how do we, you know, how do we have a smoother onboarding in that period, which often is all hands on deck, where people who aren't even assigned to the FRC are there to help. So I think some of these pieces that we're putting in place will help that to be smoother. I don't know that we'll see, you know, a complete, you know, smooth transition for this upcoming registration process. I think we'll see improvement. We're already underway. Anytime we start the process for the next year, the primary focus ends up being, you know, just placing students. So starting tomorrow, kindergarten families are going to start getting letters around their placements. And at the same time, we're trying to, you know, hire new positions and onboard new positions and implement a new phone system. So I think that we're poised for improvement. Once that rush is over, we have plans to like really roll out some of these pieces like November, December, and then we should see significant improvement for 23, 24.
So I do have one question, actually, and this kind of goes back to the Aspen. Because you're talking about that rush, the exact thing that we're talking about, that hurry up and try to get the things done at the very beginning. They mentioned that there's a potential for Aspen to be accessible for parents. I'm just curious, what languages is Aspen accessible in? And what is the level that it presents the material in, so that parents that maybe can and are, you know, technologically savvy but then speak a different language can have access to it. So I was just curious about that.
And Dr. Duda, you can probably add more. The application itself is in multiple languages. Isn't it our top 7 or just our top 3?
Spanish and Portuguese.
In Spanish and Portuguese. One of the other recommendations was around having templates so common communications that we send out to families, instead of staff having to like create the brand new message every single time, just being able to pull some of those template messages to kind of cut and paste to standardize communication.
Thank you for that. I do have another question, and it was about the desegregation of information that was discussed as a next step. I was just curious, when you say that that's a next step, what is it that you're looking to do to move that forward? What is the next step for the next step?
And I apologize, which piece with that?
Sorry, that was at the very end of the presentation. So for either of our presenters, if you could respond to what you're looking to do to indeed move that next step forward.
And so that isn't a specific PCG next step. It was something that came up during the course of our review. Those were two areas that were out of PCG scope, but were identified areas that we would recommend the district spend time digging into. And so there was several issues were flagged throughout the review process related to English learners, which from our understanding is the district has hired a consultant to begin to dig into that as well. And then the desegregation plan came up as well as an area for consideration to confirm that the written policies and procedures in that the desegregation plan align and support the practices that the Family Resource Center is adopting as well, and that there's alignment there that encourages the access that you're looking for.
And so I do believe it would be worthwhile to look at the desegregation plan and the shifts in the population since it was put into place. There's even language that's outdated, right? We're looking for a ethnicity balance between minorities and non-minorities. And so minorities are anyone other than white Caucasian students, but our district is incredibly diverse right now. We're seeing the balance. We're seeing that minority, non-minority balance, but it's not what people believe in that we're seeing, 30% Hispanic students and, 27% Asian and 8% African American in every single school building. So we're seeing minority, non-minority balance, but oftentimes there is one group that is disproportionately represented inside of the building. We also have new populations coming in, and I often talk about our Brazilian population, which is identifying as white non-Hispanic. We had students coming from Afghanistan. I think they were identifying as white non-Hispanic. So when we're looking at the minority, non-minority balance, we're looking at white and non-white. And so the white population in a school very well might be a large Brazilian Portuguese-speaking population.
I do have one more question, unless you have a question.
Thank you. One quick one, and then I want to move on to the solutions. Did we get a number of how many of the surveys were sent out? I know you gave me the time frame. You looked at families who registered between September and March, and we got 136 responses. How many were sent out?
I believe around 1,000.
Okay. So I think when you look at these recommendations, they make absolute sense about what we need to do to improve. Obviously, if we can get away from manual, where one person's handwriting and then somebody's inputting it, and then it's got to be manually uploaded again to another program, I think that's going to be huge, not only for the time factor, the interdepartmental communication. There's so many areas that will be touched on once we're able to really go to more digital. And the same with integrating the phone system. You might recall, I was one of the people asking, well, how many people called with questions? How many, and you're so busy dealing with what needs to be done during those high times, that being able to track that information became onerous. My question really has to do with what we need to do to get more up to speed with Aspen, because we've had Aspen as our primary program, I don't know, since I've been paying attention, it seems like a while. So do we have in-house expertise, or can we go out to Aspen and get the resources we need to make this happen sooner rather than later? What is the plan for integrating Aspen more into all aspects of the enrollment process?
So Aspen registration is relatively new. I believe when we adopted it the first year of the pandemic, or was it the second?
It was when we came back from the pandemic.
Yeah, the second year of the pandemic, we were one of the pilot districts. So even though Aspen has been in place for years, Aspen registration is still being built out. And that's part of some of the challenges we had with why we ended up having two systems, because there just wasn't time to test it, figure out where the challenges were going to be. And then once we were upon the challenges, we had to have the Google Doc system just to keep registration moving. Now we are 100% the Aspen registration system, but there are still things needing to be built in, and then sometimes it has to be specialized for our district upon our request. So I think, some of the recommendations around, all of the communication happening inside of the one hub. Dr. Druda, I don't know if it's completely capable of all of the alerts that we want to have right now, but that's what we would like it to do.
Right. It should be. It should be sending alerts, email alerts to different departments when a child is registered. So if a parent, for example, indicates they're special ed, the special ed department, whoever has been designated, would receive an email saying that this child is special ed, and to look at that file. They're still working on finalizing that, though. There's been some challenges with the email alerts. So our database manager is working with Aspen to get it up and running.
To follow up on that, so I think the training is going to be key, obviously, right? And especially when you're looking to, when one of the recommendations is bring in more staff, it's going to be really a challenge to get everybody up to speed with the people who've been there with the new system, new people coming in. What's your plan around the training, and what's the timeline for that?
So we've been talking about that. There will be job descriptions coming to you on Wednesday. Other job descriptions will be coming to you in July. How quickly we fill those positions depends on whether we're able to get the right people to apply. So we're pretty confident about some of the positions being able to be trained and providing support by our August rush. So for example, the health liaison is on your agenda for Wednesday, and we think that that can really be a game changer in the Family Resource Center. That's an on-site nurse to be able to review the immunization cards. We'll also have someone assigned from the Lowell Community Health Center to do new patient registration, because those are two pieces where we had to wait for families to navigate a different system. So by pulling that in-house, we think that'll cut down on some of the wait time. We're also working with some community partners around immunization clinics, so that when families come, we'll be able to give them some dates around, if you can make an appointment with your provider, great, but you can also come and get your immunizations on these set dates. So I think that will also take care of some of that wait time. So that's the health liaison. The family advocate, the front desk triage, So the Family Resource Center really is an enrollment center, but it's also treated as the welcome center. It's almost, you're gonna call that center if you're a parent, more so than you'll call the reception desk at the school district. And so that person will be able to receive those calls and to be able to track them and to be able to get them to the right offices. Whereas if you call right now, it's the clerks there to do registration. And so if you're calling around, a school-based matter, they won't necessarily be able to answer those questions. Something with the phone system, and we're still figuring out how this is gonna work, but, when you call and you get an answer and it says, for Spanish, press this number, for Portuguese, press this number, and then it also gives you a menu of, for special education services, for transportation, so that we can kind of cut down on are you really calling for registration? And if you're calling for registration, press 5, right? But if you're calling for, bus transportation, press 2, right? But then at the end of the day, you probably can press 0 and go to the family advocate who can help to get you. So I think that something like that will just help to get phone calls to the right place, hopefully. And then the Spanish, Portuguese bilingual liaisons. So this year, our liaisons were placed in the Family Resource Center for much more of the time than we had ever anticipated. And they weren't able to do the strategic work that we really wanted them to do across the district. So we do have in our budget for some liaisons, Spanish-speaking and Portuguese-speaking as our priority languages, assigned primarily to the Family Resource Center as their core work. And then the registrar for the high school, that's an area that we've really been working through. When we have students coming in from other international systems, it's hard for us to really know what grade they're in, whether they had, interrupted education, should they be coming in as a 9th grader, if they're 17 years old, would they be better served in an adult education program? Like, there really needs to be more discussion in counseling. So we feel that a position specifically tied to high school registration will also be a great help for getting the students to the right place. And the FRC Associate Coordinator, I mean, that is our dream role. We really think that would make a difference, but we're also willing to see how these other positions can help to make the process more efficient. One other thing I'm exploring is the Director of Parent Leadership, and what role might they be able to play seasonally in the Family Resource Center. Rebecca is a 12-month employee, but she also has time off on a different schedule from regular school staff. So most have summers off. Rebecca has 6 weeks off to take off at other times, but that requires someone really being there to keep the center running. So I think that there does need to be another administrator there. That could be the director, since the FRC Associate Coordinator is not something that we're looking to put forward right now, but we are looking at, how do we have a backup administrator to keep the work, and so that Dr. Duda can have the time that she needs to kind of refresh and rejuvenate from a very hectic, line of work.
Absolutely. But I do want to acknowledge that school committee woman Martin is on the line, and she does have a few questions as well, so I'm going to give her the floor right now.
Perfect. Thank you very much. I just had a few quick questions. So looking at trying to break down now that we're on the topic of actually hiring, the total number of positions that you're actually going to be looking for is, so one new health liaison, is that correct?
The
I'm
bilingual
sorry, can
family
you
liaison?
repeat? No, the health liaison?
Those would be 2 part-time liaisons to allow flexibility.
So 2 part-time health liaisons? And do we currently have one?
We currently partner with the health department. However, most of the nurses are off over the summer.
Okay. So you'd basically be, so you'd be having, we'd still have the access to the health department liaison, and then we'd be adding in 2 part-time positions?
No, this would be in lieu of the health department support. It's not a liaison. Typically, the health department manager.
It's just, yeah, the school nurses. The health department reviews the immunization records.
But this position would not just be reviewing the card, but their role would be connecting families to insurance. Because that's the piece that's missing. It's not so much the transaction of, oh, you're missing this or you're missing that. It's the, okay, I'm missing it, where do I go to get it? And that piece is missing right now.
So how would these 2 part-time liaison positions interact with the Lowell Community Health Center staff that you say is gonna be on site?
I think just probably keeping them apprised of what the needs are. Right now, the health department doesn't do the parent liaison piece, the health parent liaison, and that's the piece that's missing. The health department does read the card and then send an email to families saying you're missing these 3 things. But this person will bridge that and be able to say to the families, you're missing these 3 things. Do you have insurance? If you don't, here's where you can go. If you don't speak English, here are resources that we can connect you to. But that piece is really slowing down the process, the communication piece of health services.
Right. So, and I may be confusing this, so I apologize if I'm misunderstanding something. So you had mentioned that there was gonna be, I believe, a staff person from the Lowell Community Health Center, not the health department, from the Lowell Community Health Center, that would be helping to facilitate family getting home insurance, getting, connected with the practice. Did I misunderstand that?
Yeah, so many of our families do go to Lowell Community Health to end up getting their insurance when they're a newcomer to the country. One thing I do want to mention is that the health liaisons were, I believe, a recommendation from our McKinney-Vento office, and that's the funding that would be funding these positions for the next couple of years. But there was, that was a recommended expenditure for that funding as a high-impact activity for families that are experiencing homelessness. And our definition of homelessness is much broader than maybe other industries. So our definition is not only not having a home to sleep in, but also being in a shelter or being in a hotel or being doubled up. And we do see many families coming and
familiar.
doubling up.
Yeah. Can I, just to drill home, is there going to be a staff person from the Lowell Community Health Center situated at our Family Resource Center?
We have
Am I not-
invited them. Yes, they won't be.
Okay.
They won't be our employee, but
Right,
they
but
will
a
be their
staff person
employee.
Outposted to the Family Resource Center from the Community Health Center. I thought
Yes,
I heard
that's-
that. I'm
Yes,
sorry
that's
if I'm
that's
making
our
that up.
plan.
Okay. So one of the key connections then would be for these health liaisons, they're basically going to be, in a perfect world, walking across the room to connect these families right there to the health center, correct?
If that's their preferred insurance, yes.
Okay.
And our families
Recognizing
come.
that the health center does not provide insurance, but I understand. I mean, the connection to Mass Health would be the key thing, and I know
Yes.
that they have, most of the people who they are, who they do post at community sites, that's a key part of their job is getting clients enrolled into Mass Health, and then obviously they have access to everything. Um, okay, so then circling back, we've got 2 part-time positions as health liaisons. We've got, you're not looking to pursue the assistant director at this point?
That's correct.
Okay. But you are looking to include, was it 2 parent liaisons, bilingual parent liaisons?
2 part-time liaisons for Spanish and for Portuguese in place of 1 full-time for each position, because that'll provide us with flexibility of hours and flexibility of schedule.
Okay. Was there any conversation around taking some of the clerk positions who are doing the actual work and adding language requirements to those positions?
So
I mean, I don't know
for,
if there are any openings that would allow us to start making those, those charges, those changes to job descriptions.
so language is a priority for us. I do believe we may have someone retiring, but of the other positions that are filled, they have the positions with the languages that they speak. But as the positions become available, we definitely have a priority for Spanish and Portuguese.
So we'll see that in an updated job description. I'm assuming that they probably say preferred at this point, but that we would have the capacity to require them.
So that's our hiring preference. They are represented positions, so we would also have to discuss that with
Mhm.
with the unions.
Yeah, with the clerks union. Okay. And then my only other question was, were there specific hires at the high school, the enrollment coordinator? Is that accurate? That was the only position specific to the high school enrollment center? And
Yes.
how would that be differentiated from a traditional like guidance counselor?
Well, one, the times that the person works. So guidance counselor is a school year position. This is a year-round position. So I think that would be one of the big pieces. And then also this, there's operational pieces. So we've been placing at the high school for decades. I think this is just a way of improving the placements that have been happening. I think that before there was a clerk that was assigned primarily to doing this work, but we believe that having a little more knowledge around, the courses and the content and the international systems would help. I mean, our students are coming from so many different countries that there's a level of, understanding their home system, their grades, their school years, what they're expected to accomplish in school. So it's a new position that we're trying to figure out what exactly is the skill set needed for this position.
Okay. So we'd be,
And to
we're
follow
still
up,
gonna, I'm sorry,
I'm sorry.
Betty.
I just wanted to quickly follow up with that. Something that we did find was there were a number of people at the high school now who touch the enrollment process in some capacity in point 1 here, point 1 there. And the idea of having, as was mentioned, a singular person who really deeply understands both the nuances of the position to ensure that errors aren't being made, as well as that consistent follow-up is happening as well. So eliminating the number of touch points within the process as well, and having that single consolidated position. And
And I
most
mean, I
PCGs
appreciate that. I think one
okay.
of the keys is for me to understand is kind of what the qualifications are gonna be for this. Um, And I think where it's a new position, we'll obviously have an opportunity to look at that. And I just balance it with, and again, we toggle back and forth between this all the time, where the answer is one person who knows everything, who can do everything and makes the magic happen. And then we toggle back to that person got hit by a bus and now no one knows how to do it. So this is something that, just kind of trying to balance those two, you know, dramatic realities um, in place. Okay, so we can look forward to seeing those job descriptions as we move forward. Okay, great.
Are you all
Thank you.
set?
That's all I have
Kimmy?
at this time.
Excellent.
Thank
Thank you
you.
so much. So as you can see, and those of you who are watching cannot see, we have a full house in here for a meeting that is coming up following this one. So I just want to pivot to Committee Member Doherty, if she had any closing remarks or comments.
I'd just like to follow up on that piece about the high school. Would that person be located at the Family Resource Center? To me, that would make the most sense, that you're all you'd have one person dedicated to students at a certain age or above, but they would be part of the FRC community where all the other supports also exist. But I didn't know if you had a plan in place for that location at this time.
I think we're open to the placement. There is value to being in the building and knowing all of the colleagues and knowing how the school runs. But there's also value to knowing how the FRC office runs. And again, this is around placement and getting students to the right, school, grade, program. So it is much more operational than I guess, guidance counseling. It is an operational task. FRC is an operational task.
Well, I have to say thank you so much to PCG for a great consulting presentation, and I want to thank all of you who came here. Thank you, Ms. Phillips. Thank you, Dr. Duda. And I think that this is a really great start to what we can do to change this. I know that this is an ongoing issue with how to enroll people properly, how to make people feel that we're taking all their concerns seriously. And clearly, you guys are really thinking through these things. And I thank both committee member Doherty and Martin for asking really poignant questions, because it's important for us to make the right steps moving forward as well. So with that, unless there is anything else.
Motion to submit as a report of progress.
Absolutely.
And motion to adjourn.
I was going to say, do I have to make that or do you make that? A motion to adjourn? Yes. All right. Thank you so much.
Thank you.
Thank you all.